Welcome, everybody, to Health Talk. I'm Peter Christian. John King is right over there. Good morning, Mr. King.
Hey, good morning, Peter.
All right, and we have a special guest in studio. Dr. Michael Wright is joining us this morning. How are you, sir?
I'm well. Thanks for having me.
Well, welcome to our studio. So tell us a little bit about Dr. Michael Wright. We want to just know a little bit of history, how you got to Missoula, and why you chose to practice the kind of medicine that you do.
Sure, absolutely. Well, I was born and raised in Montana, and then I chose to become an orthopedic surgeon after I went to medical school. And then I did a fellowship in sports medicine, and with the goal of always returning back to Montana. And so I just recently completed my training, and I was fortunate to get a job at Missoula Bone and Joint here in town.
Now, you were telling me in the outskirts of the building.
In the green room.
In our staging area. Very fancy, let me tell you. That
it's green
Montana,
because of the mold, but don't tell anybody.
Montana holds a special place when it comes to orthopedic surgeons.
Yeah, it does. It does. Montana actually has a really high number of orthopedic surgeons per capita. And, we were just talking in the other room of why that is. I don't entirely know why it is, but I think it's because orthopedic surgeons just like to live here.
Yeah. There's not like a gang of you, like a secret club.
Like a posse or something like that?
Not that we talk about.
The orthopedic posse, it kind of rolls off the tongue.
It does.
So did you guys hang out together and do stuff or what?
What's that?
Swap stories? Or?
Yeah, absolutely. We meet up at meetings, and it actually is a really fun community of people, both locally and then with all your training, you go all over the country and you meet people and you connect with them and stay in touch at national meetings as well.
So with all these orthopedic surgeons, do you have certain bones you specialize in? Are you like the pinky bone guy or what?
Absolutely. That's totally true. In this day and age, orthopedic surgeons are becoming more and more subspecialized to the point that some focus on just one joint in the body, foot and ankle, for example, or hand, whereas other people still maintain, sort of a generalist type status and work on the whole body.
So what is your specialty? Are you a knee guy or a foot guy? What?
My specialty is sports medicine, and sports medicine really entails shoulder, hip, and knee for the most part. And sports medicine is typically a procedure. It entails procedures that are done with small incisions, and the goal is to repair the broken part. Whereas a joint replacement surgeon, they replace the broken part. But sports medicine, you try to repair or reconstruct the broken part. So you typically deal with athletes, younger people that have a problem that will heal after it's been fixed.
And for that segment, why is it important to have a repair rather than a replace?
That's a great question. A lot of people come in and say, I have a meniscus tear. Why don't you just put in a whole new knee? Well, the reason is total knees wear out, and they wear out over time. And especially in young, active people, those joints wear out based on the number of cycles that go through them. So if you put a total knee replacement in a 30-year-old, it's probably going to be worn out by the time they're in their mid to late 40s. And at that time, it becomes much more difficult to then put in a second total knee replacement, et cetera. Maybe someday there will be technology where you can do that, but it's a long ways off.
Now, let me ask you about replacements like hips and knees, things like that. Is there a problem with the body saying, I don't like this. I want something else, or I want my old knee back. You know what I mean? I realize that sounds kind of silly, but is rejection a problem?
Very, very rarely. There's a very, very small subset of people that have an allergy to the types of metals that are put in. People that have a very high sensitivity to nickel, for example, sometimes can develop a reaction to a total joint. But we have ways around that, and it's exceedingly rare. For the most part, they're tested. They're pretty much inert materials that the body doesn't reject.
So you get to work on younger people.
Yes.
And these are people that have injured themselves significantly, and your goal is to get them back to normal in a relatively short amount of time.
But not just normal, but also back to getting back on the athletic playing field, right?
Oh, absolutely. Absolutely. That's the goal. Yep.
So do you find is it easier because they're younger, they heal well, or because they're younger, they whine about it more? Because as a parent, I hear a lot of whining. So,
well, you just perfectly summed up the pros and cons of sports medicine. It's great because they're younger. In general, they don't have comorbidities such as diabetes or heart problems. They're young, they're healthy, and they're motivated. They want to get back. They want to get back on the playing field. So that's phenomenal, and that's the best part of my job is dealing with that aspect of it. That being said, the expectations are really high. If we were to work on, one of the Grizzly football players or even a high school athlete, their expectations are very high and they want it done perfectly. So there is, it's not really whining, but I'd just say the expectation is very high.
Well, you replace a 50-year-old's knee. and they've learned to cope with pain in life.
Right.
And you replace a 17-year-old kid's knee, and pain might be a new experience, when it comes to walking for that individual.
Yeah, there's definitely some of that. There's some, kind of hand-holding type of stuff that has to go on. But there's techniques to deal with that, and it's a big part of our job in counseling the patient, before surgery, what they can expect.
When there is, especially when there's an injury that occurs on the playing field, are you there? I mean, are you actually there do you consult some of the local teams and are there on the sidelines when the injury actually occurs, or do you see them after a couple of days after they've been home and it's all swollen up and they got to get you into the orthopedic surgeon?
Well, it's some of both. As a sports medicine physician, part of my job is to provide direct team coverage. And so I will be on the sidelines of some of the local high school football games, as will many of my partners at Missoula Bone and Joint. But it's impossible for us to cover every sport. For example, women's soccer has a very high incidence of knee injuries. And, there's just so many games we can't be everywhere. So that patient we'd probably see down the road, But for football, where there's a high incidence of injuries, we try to be at the sidelines of those games.
So do you have kids?
Yes.
Okay. What sports do you let them play?
My kids are quite young.
Tiddlywinks.
Not athletes.
This
yet.
game is called Frogger. You're not actually allowed to cross the street. So, but seriously, you watch all these sports injuries. You see the kids going out and playing, coming back with different types of, bruises and bone breaks. What sort of thing do you see as warning signs? Are there certain sports you think lead to more injuries than others?
Yeah, there definitely is, and that's been studied in some of the orthopedic literature. Football, as you're probably aware, has a high incidence of injuries. So does soccer. Soccer and football are really the sports that we see a lot of injuries that do eventually require surgery.
Now, soccer, I would not see that.
Yeah,
you're running around with the little pads. I understand the concussion thing if you're doing headers,
right?
But I mean, it's a no contact theoretically or light contact sport.
Well, the thing about soccer is where we see a lot of injuries is in the knees in soccer, and what happens is the athlete changes directions quickly, and that's when they get the injury, and that's the typical mechanism for an ACL injury. I mean, that's the classic description: is a non-contact, my knee gave way type of injury.
It's not very dramatic. It's not like the other guy hit me so hard.
Well, it is pretty dramatic when it happens to you.
Well, I can imagine.
I will tell you that having had a knee injury at one point, playing softball in the church league, it wasn't anything exciting like a football game, but it playing out in the fort, and I was chasing a fly ball, and there was a hole in the ground, and I stepped in it, and my knee went one way, and I went the other way, and I heard a, so luckily it wasn't anything that required surgery, just needed some therapy.
Right.
So I was really lucky, but I got to tell you what, I was a 30-some-year-old man. It was scary. Yeah. You lay down and you think, God, my leg doesn't work anymore. What's going on? And it was weird. So I can just imagine what it's like for a young person to be in that situation with all, as you mentioned, the changing of directions rapidly. That can really, especially if there isn't any contact. Boom, there goes the knee.
Right. And these athletes are, 100% healthy, and they go to 100% debilitated, in a matter of seconds. And so it's devastating. And it's a long recovery for some of these injuries, meniscus and ACL injuries. I mean, it's a long haul, and there's a lot of work that has to be done in the rehab before they can get back on the field at the same level of play.
So from what I'm hearing, basketball is the safe sport.
Basketball is pretty safe. We do see ACL injuries in basketball as well, but no, not with anywhere the frequency that we do in soccer and football.
We're going to take a little break. If you have a question for Dr. Michael Wright, give us a call from Missoula Bone and Joint. Here come the calls. 721-1290 is our number. 1-800-568-5309. He's here to answer your questions. Maybe you have a child who's been injured, or maybe you're concerned about a particular sport. Give us a call right now. We'd love to hear from you. Health Talk will continue in a moment. All right, we're back on Talkback. 721-1290 is our number. 1-800-568-5309. And I believe we have Dean on the line. Dean, you're on with Dr. Michael Wright. Please go ahead, sir.
Morning, everybody.
Good morning.
I had a quick question for him. I was going to say, I know he's talking about sports medicine, but I was wondering if he could fill me in a little bit on maybe old man medicine, because, I logged, and then I worked in the mill for years, and I never pulling boards and doing stuff like that for many years. And all of a sudden, after you quit working, then all of a sudden your shoulders and that and stuff hurt. Is there any way to fix that, like with not being, kind of non-invasive, or is it just something I live with because I'm getting old like Peter?
You're talking about physical therapy, basically, right?
Yeah, absolutely.
Thanks for the call, Dean.
Yeah, that's a great question, Dean. So sports medicine really entails procedures of patients really of all ages. It's just finding a way to help patients before they need a joint replacement. So someone with wear and tear type injuries, which I think you're alluding to or describing based on your logging and everything, a lot of those things can be fixed with non-operative treatment modalities, including medications, injections, and physical therapy plays a really integral role. And even sometimes surgeries are available as well.
So do people in that pain but not replace yet sort of state, do they go to you to seek therapy?
Oh, absolutely. Yeah, absolutely. That's the majority of the people that I see in clinic are going to be people that have injuries that we're going to try everything non-operative first before we start talking surgery.
Gotcha.
So
I would imagine, though, being an orthopedic surgeon, that you would, because the mindset is, oh, you're obviously thinking cut first and talk later, but you want to talk first and cut later. Is that right?
Well, yeah. I think that's really what's in the patient's best interest, and that's what I would counsel a family member on. If there's a way to avoid surgery, I think you should. That being said, in this day and age, surgery you can have phenomenal results, with surgery.
Okay, let's get Jim on the line. Jim, you're on with Dr. Michael Wright. Go ahead, sir.
Jim, you're on the air.
Jim, go ahead. You're up.
I'm up.
Yes, sir. You're on the radio, sir. What's on your mind?
Okay, well, I just had a question about microfracture surgery. I wonder if you guys do that there. And I had it done on my left knee about 5 years ago, and I think the results were outstanding, and I wonder if that's a permanent fix or it's temporary.
Okay, thanks for the call. Microfracture surgery.
Yeah, we do microfracture.
What is that, first of all?
So microfracture is a solution for a patient who has damage to the articular cartilage in their joint. Now, that's the shiny cartilage on the ends of the bones. And when a piece of that breaks off or is damaged, there's really no way for the body to grow it back like it was. It's never quite the same. So microfracture, we use a series of instruments to make little small holes in the bone in that area that allows the bone marrow to then replace that damaged area with scar tissue. And it's a type of cartilage that's not quite as good as the original cartilage, but it does seem to help people's symptoms. Is it a permanent solution? The answer is maybe. Sometimes people have that done and they never need another thing done, and other times it breaks down further. It all kind of depends, Jim, on the size of the lesion and how well your body was able to make that scar tissue patch.
So, sorry, you go in there and you make scar tissue.
Yes.
Well, why? I assume you do that by cutting it or something, right? You got laser or something, a Death Star?
We use some very small, sharp instruments that are like metal awls or a small drill bit to make very, very small holes in the bones. We're talking 1 to 2 millimeter holes in the bones. And we just drill down just enough so that it hits the bone marrow. And once it hits the bone marrow, there's all sorts of cells and nutrients that then come to the surface of the bone, and then that allows the body to be able to make scar tissue. But if we didn't poke those holes in there, it'd just be solid bone.
Why not just glom on some rubber or grab some cartilage from your ear and push it in there? I mean, why this weird technique? And who came up with this anyway?
Thank you, Dr. John.
Yes.
This is why I don't want to go see Dr. King, if you don't mind. Go ahead.
Well, that's an active area of research, cartilage regeneration, and there's a whole host of different treatments that you can read about on the internet trying to solve the problem that we're talking about. Microfracture is a pretty tried and true way, and it's simple and cheap to do. But you bring up a good point. There are some novel cartilage replacement techniques, which is very much in the realm of sports medicine, where sometimes you can take a donor from a cadaver or something and you put that cartilage in there. And there are some new techniques where we can harvest cells and then actually regrow the cells and replace that in there. But all that is really under the label of experimental at this point.
Do you and your fellow orthopedic surgeons ever just sit around a beer or a cup of coffee and just marvel at the wonder of joints? I mean, elbows and knees and shoulders and just the way we're so, as the Bible says, fearfully and wonderfully made. There's just so much going on in there. And you look at the complexity and you look at the amazing way we're put together, and you get to go in and fix that.
Yeah, I mean that was one of the reasons that I personally was attracted to orthopedic surgery. It was the anatomy of the body, and it's so intricate the way the muscles, tendons, ligaments, nerves all work in concert to make the elbow, for example, work, or the shoulder. And you think about the shoulder, I mean, it has nearly 360-degree range of motion, and all the things that have to happen perfectly in order for you to achieve that motion. It is fun to think about, and you really have to have a solid understanding of that to develop ways of fixing the problem as well. So yeah, it is. I'm very fortunate to work in the field that I do.
So, what's the cutting edge, joke intended, when it comes to orthopedic surgery? Are there going to be new stuff coming through, these experimental things, or things looking like they're going to be here in Missoula in the near future?
Oh, absolutely. Absolutely. I mean, the field of medicine is just rapidly expanding. You know, the problem that I have with jumping right in and trying these new things is I really want to see some long-term follow-up, you know, before I start putting into people, you know. And so that's really the downside of some of these new novel things that I've mentioned during the show today is we're really waiting to see, hey, what does it look like at 10 years, you know, and what does it even look at 5 years for some of these new therapies? So is it going to be tried and true? Is it worth it? Is it a cost-effective solution? You know, there's so many pressures on surgeons today to kind of solve all those problems.
Including pressure with commercial breaks?
Yes, as a matter of fact, I'm the commercial sheriff. We need to take a break here. If you have a question for Dr. Michael Wright, phone lines we have 4 lines. We'd love to fill them up here in the last 10 minutes. If you have a question about orthopedic surgery or perhaps someone in your family that's experiencing some problems, give us a call. It's a free consultation, folks. 721-1290 is our number. We'll be right back.